I have two diagrams I'd like to show you now. One diagram is showing the correct position of the lower jaw with the jawbone in such a position that there's a space between the jawbone and the ear here. Because there's nerves and blood vessels here. If that jaw goes back too far, it's going to compress the nerves and blood vessels. The disc or cartilage fits between the two bones and acts like a cushion. You don't want the bones to touch. That can cause osteoarthritis, can cause crepitus, all kinds of loud noises. You don't want that. So the photo on the right is showing the wrong position of the jaw. There, the jaw is back too far. In fact, the jawbone is almost touching the ear here. And there's a very small space and the nerves are being compressed. And what's happening is the little piece of cartilage, which in this photo over here is right on the head of the jawbone, is now in front of the jawbone. So what happens is when the patient opens, the jawbone goes over the disc and causes a click. So if there's a click, that means the jaw is in the wrong position and the disc is in the wrong position. So what we do, we try to put a lower splint in, which moves the jaw from this position to this position, and the disc goes back in the right position, and then when the patient opens and closes, there's no noise, no clicking. So clicking is bad. And clicking can lead to jaw locking if it's not fixed. So it's extremely important to fix this problem before the patient jaw locks. Again, another diagram there. There's the disc on top of the head of the condyle, good position. Here's the disc out in front. So remember, every time the patient opens, the jawbone goes on the disc and causes a click. So clicking's bad. And clicking can lead to jaw locking. So that means, we've talked about that. So there's stages of clicking jaws. We actually call it internal derangement. Internal derangement means problems within the jaw joint. So there's 5 stages of clicking or 5 stages of internal derangement. Okay, the first stage is TMJ clicking with no pain. So there are lots of patients who are clicking with no pain and no symptoms. So we do not treat those patients. We only treat patients that have symptoms. Nobody wants me to put a splint in their mouth, which they wear all day long, if there's no discomfort. But I tell my patients they're in stage 1 if they start getting into symptoms, headaches or tinnitus or ringing in the ears or any of the symptoms, come in and we'll treat you. So stage 2 are the ones that I treat the most. Stage 2, most patients that are in pain are in stage 2. So they're clicking jaw and their jaw gets stuck a little bit, called intermittent locking, which means they wake up in the morning and the jaw is kind of stuck and they have to move it all around to get it unstuck. And they're in pain. That patient has to be treated. If that patient with intermittent locking is not treated, it could cause a permanent lock. Remember, the permanent lock is very painful. That's when the disc gets stuck in front of the jawbone. Okay, and the treatment there is a lower daytime splint to move the jaw to a position where they don't click. Move the jaw to a position where you don't click. Otherwise, the splint is not going to work. And an upper night appliance. And I talked about that. I will be talking about that. Lockjaw is when the jaw goes back too far and the little disc slips in front, but it sticks in front of the condyle and you can't open. Lockjaw is when you restrict the opening of the jaw, and instead of the patient being able to open 50 millimeters, they can open 15 millimeters. They can only get 1 finger in instead of 3. So you don't want that. You want to fix the patient when they're clicking so they don't lead to jaw locking. And again, the treatment is lower splint to wear during the day to prevent the clicking, because when you move the jaw forward, the disc goes back in the proper position. And also a night appliance to prevent the clenching and grinding at night, Because remember, the clenching, grinding at night, the patient wakes up with headaches, and you don't want that.